If you're a nursing mom and you've been struggling to the fact that probably your baby keeps crying even after each feeding, or tends to feed every short period of 30 minutes to 1 hour, and you're concerned to know to whether if you can continue your exclusive breastfeeding for the first 6 months of life, then this video is surely for you. Do stick around. Hello there, welcome back to my YouTube channel. My name is Chinenye, and welcome on board. If you're new to my channel, you're welcome. Kindly hit on the subscribe button if you've not done so, and subscribe to my YouTube channel and turn on the notification bell so that you get to know anytime I upload a new video. So today we'll be talking about the difficulties associated with breastfeeding and why your baby might not be getting enough. So usually, every woman has two breasts, and so the anatomy of the human breast is in such a way that every woman has the same number of lobules in each of her breasts, meaning that every woman has the tendency of being able to produce as much milk to be able to feed that baby as the next woman. There are some few women who have much supply of milk, but on the average every woman produces as much milk as is expected. But we know those things are actually linked or associated or can be reduced due to some lifestyle factors or some factors which I'm going to explain in the course of the video. Why might this be so? It might be the way you are actually positioning your baby, or the way the baby is latching on the breast. The baby is supposed to latch on the areola part of the breast, which is that black part of the breast. The baby's gums is supposed to be around that part, not on your nipple, so that you don't get to have a sore nipple afterwards. Because the fear of sore nipples is actually what makes most women not to breastfeed their baby as much as they should, or because they already have sore nipples, that fear of and the pain, it makes them not to allow the baby suck as much as they should. Okay, your baby is supposed to latch on the areola part of your nipple, and when this occurs, you see the baby tends to suck properly, and in allowing the baby suck as early as possible, just immediately after birth, their sucking reflex at that point or at that moment is actually high, and allowing the baby to suck in the first 30 minutes to 1 hour after birth actually enables and improves their sucking reflex. That aside, there is this thing most women make mistake of while breastfeeding their babies. You see, while breastfeeding your baby, you are not supposed to breastfeed on the two breasts at the same time. How do I mean? You're not supposed to allow the baby to suck maybe barely for 5 minutes here and the next 5 minutes here. No, that way the baby does not get as much to hold him or her for as long as it should. The breast milk contains two kinds of milk. There's a fore milk and there's a hind milk. Usually the fore milk is actually between the first 10 to 15 minutes while the baby is breastfeeding or suckling on your breast. What the baby is getting at that moment is called the fore milk, which is more watery in nature. Then afterwards, after the first 10 to 15 minutes, the baby gets what is known as the hind milk. The hind milk is actually what contains more nutrients that is going to give the baby more sustenance for at least 2 hours. You don't tend to run around to try to feed your baby again. But because we make that mistake of suckling the baby here just for 5 minutes, and the next 5 minutes you're taking the baby away, that way the baby does not get that hind milk that is supposed to sustain him or her for as long as expected. So What are you supposed to do? Allow the baby to suckle on one breast for at least 20 minutes. For at least 20 minutes, allow the baby to suckle on one breast. And when this happens, you find out that that breast would definitely must have been empty. So that the baby is supposed to suckle on the breast until it is empty before you switch over to the next breast. And definitely after 20 minutes, the baby should be okay. But even if the baby is not okay after 20 minutes, if you feel your breast and you feel there is still some milk in it, like it is not empty yet, like being flabby, you can still allow the baby to suckle on it. But if after 20 minutes you can feel that that particular breast is flabby already, which is light on it already, then you can now switch to the next one. But until this happens, do not switch your baby from breast to breast. That way you find out that your baby gets sustained for as long as possible, and you don't feel the stress of exclusively breastfeeding your baby. And another thing, it's a mindset. You must be willing to do this. Do not see it as a struggle. Do not see it as a worry. Do not see it as let's fulfill all righteousness. Do it or see it as, okay, yes, I'm feeding my baby. I'm wanting my baby to stay well. I am doing this for the well-being of my baby, because my baby will be healthier, get antibodies from me that would make him or her not fall sick. That's passive immunity. Just do this for the love of you and for your baby, not because you're just just wanting to do it. So this actually, the mind also actually helps, and ensure you feed well, ensure you take as much water as you should, as expected. Like I've always mentioned, do not wait until your body gives you a signal of being thirsty before you take a cup of water. Stay hydrated because you need it, your baby needs it. Eat adequate meals, because this is also reflected in the flow or the boost of your breast milk also. Then do this even when you walk and you also want to breastfeed. Check on for your working place for their guidelines or policies as regards nursing mothers. If it is favorable, why not? You can have your baby around close to a nursery, or have breast milk expressed if you have someone to nurse your baby. But mind you, when you express, ensure you take proper care and measures on how to protect or how to preserve the breast milk so that it doesn't get stale. And for everything you do for your baby, remember that you are grooming a healthy baby, or you're wanting to groom a healthy baby. So I hope you found this video helpful, and please hit on the subscribe button, please, if you've not done so up till now, and do leave a comment if you have any question as regards this video, any other. Please drop in the comment section and I'll be glad to reach out to you. Thank you for watching, and I'll see you in my next video. Remember to always stay healthy and create your happy place. Bye for now.